Thank you, Dr. Pedro. Is it also possible to have the slides shared from your end, or I can share myself? In the meantime, thank you very much. Brilliant. Good. Is that okay? Okay. Thank you, Dr. Pedro, once again, and I would like to thank the forum and the presiding Dr. Mark Barone for inviting me to speak at this very distinguished panel. To really also thank Dr. Guy for giving this very good presentation of the initiative that the WHO has taken on board last year with the consultation. And I can say that we are really, as him, first of all, we are very grateful as a patient alliance that such a process has taken place, but we are also very proud of what has been discussed during those 3 days, because our members have also participated, and that is a true confirmation that whatever was said was really happening, that the people living with NCDs were heard. If I can have the next slide, please. My name is Neda Milevska-Kostova, and I'm the Vice Chair of the Governing Board of the International Alliance of Patient Organization. It was established in 1999. We represent more than 280 patient organizations and patient alliances, addressing the needs and sharing the voice of more than 1 million patients. They are based in more than 70 countries and represent more than 50 disease areas. Our vision is to see the patients at the center of healthcare, and the mission is to really try to build that kind of a system together with other stakeholders. Obviously, we believe that patients need to be at the center of the healthcare, because that will help not only the individual patients, but also the healthcare systems and the society at large. Next slide. So I was asked at this presentation to speak about why, when, and how to engage the persons living with chronic conditions. I would like to quote at the beginning Sir William Osler, who said that the good doctor treats the disease, but actually the great doctor treats the patient who has the disease. And we can simply extrapolate this also to health systems or to health policies. As Dr. Guy rightfully said, if we do not meaningfully engage people living with the disease throughout the entire cycle and the process, this will not really give us the impact or the desired results that we would want. So just to illustrate, if we have a person living with a chronic condition, they may be coming in the contact with the healthcare or social services systems a number of times in the day. Even by taking the pill, they are reminded that they have this disease, but otherwise 24 hours they have to live with that experience. And again, as rightfully said, this experience is something that we can use not only in the creating of the policies, but in implementing them. If we go to the next slide, which I will not really elaborate in details, because it was the ground for why we need to engage each individual stakeholder was really very well laid out by Dr. Mark in the earlier session. It was in Portuguese, though, although it was really very clear that we are still very much struggling with NCDs being the silent killer of more than 70% of mortality occurring due to the chronic diseases. And while everything was overshadowed by COVID, and obviously reasonably so, because we have an acute situation to handle, this other underlying condition has not been waived or cannot be really waived. If we go to the next slide, although I don't think that these are the last version of the slides, but in any case, now having the why and the 70 and more percent, as I mentioned, of those mortality cases, actually 1/3 of them are premature deaths, something that we would all want to see waived from the map, wiped from the map, in the sense that those are not only economic costs, but those are lost lives of the dear ones, or lost opportunities to thrive, lost opportunities to see someone graduate, or lost opportunities to see someone get their own family. So beyond setting up that, it is important also to discuss when, and again, I would say that it was fairly well described by Dr. Guy, that, thank you very much. Now, as it was mentioned, people living with the disease, they have their own expertise that they live throughout 24/7. So the question when they need to get engaged is, I think the answer is right now, or at any time, because they really live 24 hours with their expertise. Now, it is very difficult to expect that any policy having their own living cycle can introduce anyone at any particular moment that they have. Next, please. But then again, that policy cycle that has its own steps and its own living model, it coincides a lot with many of the roles that the patient can play. And this is only to illustrate. If we go to the next slide, maybe we can see in more details how we at IAPO envisage the involvement of patients. Next slide. How we envisage at IAPO involvement of patients in across the cycle. So in 2020, just to go back to one of the earlier slides, without going back to the slides, I just want to refer to something. In 2020, International Alliance of Patient Organizations, being the alliance of patient organizations, has considered that we need to also change the way in which our constituency is involved. So instead of just waiting for the policies to change, or waiting for a government to craft whatever we would be expecting to be a meaningful policies for our well-being or quality of life, IAPO established the IAPO Patient for Patient Safety Observatory, which is really supposed to be building across the three pillars of potential and possible engagement of patients and caregivers. And as Dr. Guy, I will refer once again to him, as he mentioned, to avoid as much as possible the tokenistic approach, and to avoid as much as possible only the single storytelling. We notice that there are many conferences in which we are invited, or there are many places of discussions and policy dialogues where the narrative, the patients are invited only to fill in the story with the narrative. And that is still just a very anecdotal way of involving them. So our Patient for Patient Safety Observatory is intending to fill in this gap by addressing and building the capacity of patients with these 6 roles. So we all know that patients have been involved. The top 3 roles are even now present. Patients participate in clinical trials, they participate in qualitative studies through interviews and so on. Sometimes they are advisors to governments, but the latter part, the latter 3 roles of the patients are still not as much fulfilled. So we are trying to build the capacity of the patients to become reviewers of specific policies, or to be reviewers of the research, even to be co-designers, and finally to be the driving force. So using this experience and expertise, lived experience that Dr. Guy and Dr. Mark and other speakers earlier have mentioned. And by saying this, next slide, we would like to really bring that experience and expertise through the 3 tiers that we have developed through IAPO and through our new observatory. And that is to empower the patients, or to empower the caregivers or patient organizations through different trainings, development of tools, advocacy, and so on. So to equip them to a more objectively, I know it's very difficult when we say to objectively, because they live subjectively what they live. However, to try to give them the tools into their hands so they can objectively and meaningfully engage. And the second one is really to try to engage them into the research beyond the research subject role, as I explained in the earlier slide. And the third one is something that also Dr. Guy was mentioning, and Dr. Patrizia in the in the explanation of the Brazilian case, that actually we would like to also see them shaping the policies and being involved in the policy making and in shaping the policies beyond the anecdotal level. So to give them a more robust knowledge, to give them a more significant training on how they can step aside as much as they can from their individual situation, to bring it objectively on the table and to try to really participate in any policy dialogue, or at the individual level when they discuss with their doctors and so on. Next slide, and I think we are nearly done. So this was all talking the talk, as mentioned earlier, but just to try to bring to your attention something that I think would be of interest for all of us to engage in contributing to these debates. And I believe that these 3 calls for experts are really part of the walking the talk that it was mentioned earlier, that beyond the report where we heard how persons living with the disease can be engaged. These are the next steps of WHO creating the technical advisory groups on prevention and control of NCDs, on research and innovation, and one specific one on diabetes. I have listed only 3 because their deadline is coming up next week. Please look out for those, not only at the WHO, but the UN also. They have a policy dialogue on antimicrobial resistance also next week, to which we can submit questions on how we want some aspects of that addressed. And I'm mentioning antimicrobial resistance here specifically because although it sounds very far and distant from NCDs, antimicrobial resistance is really affecting people with non-communicable diseases, and especially people needing surgeries, people needing immunosuppressing therapies, and so on. So all of these types of consultations we need to engage as much as possible. These are only listed as a global ones, but there are regional ones. There are some, I'm sure, on national level. I'm so sorry, I cannot really try to find those ones that you might be interested in the Brazilian context or in PAHO context, but please look out for those and engage as much as possible, either individually or through your alliances, through your patient constituency, because it is about engagement. It is about speaking up what we have lived through, and our observatory will be trying to give the necessary capacity to make it more tangible, or to make it more closer to a policy-making jargon, if you wish. Next slide, which really has only a couple of takeaway messages. And I think most of it has already been said, but just to reiterate that we at IAPO believe that the systems exist for people and not vice versa, and that systems that exist right now were created to put the structure, but the main aims somehow we lost on the way. Now this COVID and maybe these other underlying conditions and pandemics like NCD or AMR are really giving us the opportunity to rethink and to build back better, as it is now becoming a very common phrase. And societies should really try to create systems for and with people, rather than systems that are structured around diseases or facilities. As Sir William Osler said, we need to treat the person and not the disease, because that person has their own wishes, dreams, desires, and so on. And those persons have living experience, and they know the art of how to convert challenges into opportunities. Just one last click, and I will thank you all. Next, please. And just I want to finish by saying that the wealth of a society is not a goal in itself, but it should be a means for ensuring good health and well-being and quality of life. For the longevity is just something that we want to all enjoy as a nations, but as individuals as well. Thank you very much.